Hello and welcome to Crime Pain Conversations. Today we are honoring the upcoming Bell Let's Talk Day by looking at depression and mental health. We'll be looking at types of depression, causes, symptoms, and ways to get help. Kalila and I will be sharing our own personal mental health journeys, and of course, we'll be diving into our question of the week. Have you ever been in a dark space? So, are you ready for another chronic pain conversation? Let's go. My name is Sharifa, and this is my lovely co-host, Kalila. This is a show where we have open and honest dialogue about chronic pain. We share on our experiences, acknowledge the wide variety of chronic pain diagnoses, and look into ways to manage chronic pain. So to start our show, we're going to go right into pain or pleasure to get a status on where both of our bodies are at. So Kalila, pleasure or pain?
Both. Both. The pleasure is that I just launched my first book, Sharifa. It's a milestone.
I'm so proud of you.
So I'm so elated. The pain part is I'm still struggling with my relocation back here to Canada. Mm-hmm. Last night, even after us prepping for the show, I couldn't sleep because the bone chill the chill in my bone in itself was in my legs and it's in my elbows. And it's like when I try to stretch out. So, I know one of the things that we're always talking about is don't judge a book by its cover. So I might be pretty right now, but it doesn't mean that I'm not in pain. So that's where I'm at. But girl, tell me, how was your weekend? Where you at? Pain or pleasure?
So I'm going to have to say all pain right now. Like, it's so funny. It might sound funny, but I have a pain in my elbow. Of all places, it feels like I hit my elbow against something really hard. And, it's shooting up into my arm. So, but other than that, with this show, I am all pleasure. I'm so excited for this show.
You're enjoying this so much. Okay. So let's get into our conversation for today. Are you ready?
I'm so ready.
Sharifa, Did you know that the onset age for depression is 32 and a half years?
Wow.
Okay. As of 2017, 30 million people around the world have depression, according to the World Health Organization. Now, here's the one that's really going to hit home. On December 8th, so we're talking less than 2 months ago, US Facts updated a report stating as COVID-19 cases rise, 37% of adults are reporting a significant symptom of depression. Now, that's almost like that's above 25.
Yeah.
That's above 35. Yeah. That's almost 40%. Like, we're talking 37%.
Without COVID, the numbers are still high. The stats is still high.
And the stats are ridiculously high, Sharifa. Mm-hmm. Let's talk about the fact that we came across 6 different types of depression. There's more, but I'm going to just talk about a couple of them because, right now, if you're like us in Canada, you might be experiencing something called SAD, which is called seasonal depression. It's called seasonal affective disorder. And this is when your mood is changing, typically between autumn and when it's coming into winter. Now, what's very funny in me doing the research behind this is that it very rarely occurs in summer and spring, but it does occur in some people. Can you imagine that? Even though you're getting your vitamin D from the sun, you could still be having a SAD episode.
Wow.
Okay. Now, here's something interesting. About 2 to 3% of Canadians will experience SAD in their lifetime. And another 5% will experience a milder form of this, but they'll only have slightly depression. So they'll still be able to deal with their life and not have major disruptions. But that's still 18% of Canadians. Mm-hmm. Let's talk about the one that mama goes, she gets pregnant, 9 months later, she has baby blues or postpartum depression. Mm-hmm. And, people don't think about this, but this is really something serious because it causes a woman's hormonal change when she's given childbirth. And there's the lack of sleep. And then there's the pressures of taking care of a new baby. Right. And they go through things like mood swings, sadness, and fatigue. Like, this is serious even for women that are going through pregnancy. Mm-hmm. One that everybody's really familiar with is bipolar disorder or something called manic depression. And this is where you have the mental illness marked by extreme shifts in mood. So you could have, be really elevated and be in a state where they called mania. And then you can be in the complete opposite part of the spectrum and be in what's depression. So that's why they call it bipolar. Now, the ones that people don't really talk about that I want to touch on are things like the clinical depression, which is also called major depressive disorder. And that's the cause of persistent feeling of sadness and loss of interest. And do I have stories behind that for myself? But it affects how you feel, think, behave, and it can lead to a variety of emotional and physical problems. You can lose weight, you can put on weight, you can stop eating, you can be overly emotional. And it's estimated that 6% of adults have at least one major depressive episode every given year. Sharifa, every year. Like, I'm so glad that we're talking about this right now. And I'm so glad that Bell Let's Talk does this at the beginning of the year, because then you have something called persistent depressive disorder, right? They call it, it's also known as dysthymia. And it's a lower level of chronic depression, but it lasts longer. So you might not be completely sunken in, but you could be being in a depressive state for over 2 years. What kind of pain do you go through mentally, physically, emotionally, knowing that you're in a depressive state for 2 years or more? And the one that people are so biased against, or they don't lack understanding with, is when it comes to like the psychotic depression, right? This is when you have your major depressive disorder, but you also have psychotic features. So you're having hallucinations and you're having delusions. And what's happening is the content, the thoughts with these hallucinations and things are inconsistent with depressive themes. So you might feel like you're inadequate. And so the hallucinations and your delusions are putting you down even more, making you feel more inadequate, making you feel more guilty or worthlessness. And now here's what was hard for me. About 3 out of every 100 people will experience an episode of psychosis in their lifetime. It's not 3 out of 1,000, 3 out of 1,000,000. We're talking about 3 out of 100. Yep. So this means that it's affecting a lot of people. And so when we're talking this about chronic pain conversations, chronic pain is so many different aspects, but there's so many different causes. So come and enlighten our audience about the different causes for all these types of depressions that people might be going through.
Okay, so it's not known exactly what causes depression. As with many mental disorders, there's a variety of factors that might be involved. So you can start out so simple as low self-esteem. So we will see low self-esteem in maybe like our teenage girls and stuff like that, right?
Right.
Anxiety disorder and post-traumatic stress disorder. So yes, sorry.
It's okay.
Post-traumatic stress disorder, like PST. Sorry.
Right.
Okay. So then you have traumatic life events, such as like, you lose a loved one, you have a major surgery, there's like an accident that you got into or something like that. You have physical and sexual abuse. You have chronic diseases like diabetes, multiple sclerosis, cancer, and other stuff like that. Also, prescription medications can be a factor. You talked about postpartum, so hormones. The hormones, the changes in the body, the balance of your hormones may be involved in triggering depression. It can also be inherited. So if you have a blood relative who has that kind of condition, it can carry into the genes that, causes the child to later on develop it as well.
Wow.
Yeah, that was an interesting one. And then this one is kind of common, where environmental factors. So when you're exposed to violence, if you've been neglected as a child, if you've been abused, if you live in poverty most of your life, that will make people more vulnerable to depression.
That is, I think what I love that we're talking about this is that a lot of people don't realize the different causes and the factors that put into this, in terms of like, there's so many things. It could be your meds. Like your meds could do it. And I know that but here's the thing, like we'll watch we'll watch commercials and it'll say that, this might cure, your headache, but you might have diarrhea, constipation, suicidal thoughts, depression, manic.
A whole long list. It's like, hey, what are you giving it to me for?
Right? Your medicine can be affecting you. The fact that you're just having we don't talk enough about the fact that there's traumatic life experiences, or that you've been through something that can leave you in a state of depression. It's really, it's rough. Do you know what I'm saying?
It is rough.
So,
And I know Kalila has an amazing story, but I just want to share a little bit of what I went through when it came to mental health.
okay.
When I look at the causes, I can actually agree with some of these causes. First of all, for lupus that I deal with, I have to take prednisone. Now, prednisone is a steroid. And I remember I said to Cleela one time, like, I'm always in my room. I don't like the light. I would be in the dark, and I'm okay with the dark. But it was actually, I want to say a month and a half ago, Cleela, after we had that conversation, I was talking to my doctor about it, and he was saying that prednisone actually puts you into that dark space where you don't want the light. You don't want your windows open and all that stuff like that. And being it winter and dealing with SAD, it makes it 10 times worse. So that's something that it's like on and off for me, is taking the steroids, right? But I do remember 2017, I just had 2 major surgeries, and mind you, it sounds crazy, but one arm kept on clotting. And so at some points it would like literally like just burst open, and then it started bleeding. So I was in the hospital for a good like maybe 2 weeks. And within those 2 weeks, I had to be in and out of the OR, I kid you not, 9 times before I could have went home and like properly healed. Okay. So we're talking about from October to, I want to say, about June, I was home, not doing anything, because honest to God, both my arms had like wounds from surgery, and I couldn't do anything. I was taking hydromorphone, which is very addictive if you take too much. And it also hallucinates you, along with me taking prednisone. And from that, I was like, I have 2 arms. I can't do anything. I can't do things for myself. Because think about it, guys. When you think about your day-to-day life, your hand is like your main function. It helps you pick up something. It helps you brush your teeth. It helps you take a shower. It helps you do your hair. Helps you put on clothes. Like, you know, and I couldn't use both of my arms. Okay. And at that point, Kalila, I was saying to myself, listen, like, I don't know what else there is to do. I'm depressed. I can't go anywhere. I can't even wear a jacket to go take a walk. Like, I was just over it. And at that moment, I remember one day I was home in my mom's room watching TV, and I had the hydromorphone beside me. And I said, okay, like, at this point, I'm just, when I say I am over life, over it. And I had to think twice. And something in that moment just made me call my mom and kind of tell her, like, listen, this is what I'm thinking of doing. Like, I can't take it no more. And, you know, after her talking to me, that's why I 100% think that it's so good to have that support system, especially when you're going through things, that you can pick up the phone and call someone and let them know what's going on with you. She immediately talked me out of it. She right away went to her HR, got me like a psychiatrist, someone to speak to me, all that stuff. And that's when I started going to counseling. But at that moment, I looked at it, even with the stats that you read, Kalila, is like, I looked at it and I realized like I was a part of that statistic that thought suicide, thought, you know, a sense of worthlessness. And, you know, and I now realize like any and anyone can go through it. I had this thing where I've actually had someone tell me, like, you know, because you're Christian, you believe in God, you should never have those thoughts. But I was just like, that's not true. It doesn't matter what, because sometimes life just gets hard. Life can hit you like a ton of bricks. And, you know, it's just for you to reach out and get that help and seek that help. But yeah, that's about my story that I wanted to share with y'all. But I know, like I said, Kalila has an amazing experience, and I would really want to hear from her.
Well, geez, I mean, amazing experience is kind of kind of rough.
Not amazing, but an experience that I know would be nice to share with everyone. Does that sound better?
Okay, that sounds better. Okay. All right. So here's the deal, you guys. I've been diagnosed with mild to severe depression many times. I've had my bouts of SAD, and I've had 2 suicide attempts. I was going through some of these stats, and I realized, you know, even in my early childhood, when my sister moved away, I had gone through a phase of being depressed, pulling back, getting myself kind of into trouble, like even on the playgrounds. As a teenager, I had feelings of being misunderstood. I got into drugs. My grades dropped. I became rebellious. And the first time that I attempted suicide, I was about 17 or 18. And part of my rebellious state was about, hanging out with the downtown gangs and things like that. And back in the day, they used to have the all ages club. And so I took a liking to one of the club promoters, and he invited me out for a date. And that date turned into me getting raped in his hotel room. And it turned out I ended up getting pregnant from that. And it was a very hard time. And I wanted to keep the child, but then I decided that I was going to have an abortion simply because of the nightmares and the dreams and the ways that it was affecting my mental status. And I had my abortion the last week of the first trimester. And that had put me into a really downward spiral. And maybe about a week or two after that happened, I remember being in the bathroom and my mom coming in, and I guess she had seen the symptoms and she just confronted me and she's like, "Are you pregnant?" And I told her yes. And I told her that I had been raped. And that made things worse for me. And then a few weeks later, still being in this really depressive, manic state, severe depression state, I got into a fight with my mom one day, and I had decided I'm checking out. I had grown up in a dysfunctional family. I had already been, abused. I had gone through a lot of different things, and I had already been through group homes and children's aid. And I was like, I'm done. And I was at the time, what was for ADHD and ADD on something called Ritalin. And what I did was I had a fresh prescription bottle and I took half, I crushed it up. I poured half of it into this long, tall glass of lemonade. And then I popped pills as I drank the lemonade. And I was ready to be like, I went up to my bed and I went out. I'm told, because I was out this whole time, that my mom and my brother, like because of the fight that we had, she just went to work. My brother went home and came back and he found me still there. And they were like, something's wrong. And I just remember waking up at Sick Kids Hospital, and I having to get my stomach pumped and having to be in a ward where they were just checking on me and making sure I wasn't suicidal. That was my first episode. Moving forward, I had been in and out of my parents' house from the age of 14. And what I didn't know was living in a lot of basement apartments, because that's all you can afford when you're on welfare and you're trying to make it on your own. I was experiencing SAD every winter, not only because I was already, prone to being depressive, but having that environment in the wintertime just made it even more. So I had gone through a lot. I've been on my own since I was about 14. A few times I went back home, but from 14 till about, 2017, for about 20 years, I lived in mostly, basement apartments or underground. So there wasn't a lot of light. So I dealt with SAD a lot in the wintertime. In my early 20s, I had a miscarriage after I was with my live-in boyfriend. And I had a real bad depressive state because he told me he didn't want me to have his child by sticking a knife in the wall beside my head in the kitchen. And this was somebody that I had been living with for many, many years. And that trauma that, had been really rough for me. Fast forwarding, it's like, how many things has she been through? 2016, I was researching my book, my biography, not the one that I just wrote, but another one that I'm working on. And I was disclosed to a lot of new information that I had not known. And I had become very depressed and very angry, spiritually, even at God, for allowing me to be put into the family that I've been put into and to giving me the life that I've been given into. And I was ready to jump off the bridge between me and my sister from another mister's apartment. There's a bridge. And I literally thought about doing it. And the only reason why I didn't do it was because my nephew looks on to the bridge and he would have been like, oh, well, that's where Auntie Keela jumped. And I didn't want to leave him with that kind of trauma. I didn't want to leave my niece and my nephew with that. And then even after all that happens, in 2017, I end up in a car accident that literally changed my life, which is pretty much how me and Sharifa's journey started together on this course. And in 2017, Thanksgiving weekend, I had to voluntarily admit myself into the psych ward at one of the hospitals, simply because I later found out some of the meds that I was taking could have been giving me a psychotic break, suicidal thoughts. And when we're talking about suicidal thoughts, we're talking about your kitchen knife saying, slash your wrist. We're talking about your balcony saying, come jump off of me. We're talking about the street literally in your mind saying, come walk in front of a Big Mac truck. And these aren't things that people want to think. These aren't things that these are things that your body's doing. And it gets really hard. So, this is part of the reason why we're so big about this chronic pain conversations, is because we wanted this to come back on. But those are just a few, Sharifa, a few of the depressive, suicidal, mental health breakdowns that I've had. And this is why I really want to have this conversation with people. You're muted. You're still muted. There you go.
Anyways, my question to you is, listening to your story and everything you've been through, it's heartbreaking, because it's not just you. There's a lot of other people who go through this, but just they don't talk about it.
Yeah.
But with that being said, who or what was your support? Like, I don't know. Did you have any support going through all this?
I have seen a lot of counselors through the years. I've been in support groups, both in my school and outside. I have fiber groups that I'm part of right now. I utilize family and friends. I think one of the blessings, as much as it can be an annoyance, is that I advocate for myself. Mm-hmm. So when I'm dark, I don't want to be there.
Yeah.
And I will fight to find a way out. And it was really funny because my psychologist, when I called her from being in the psych ward, she said to me once, you don't know this, Kalila, but the reason why you're at the hospital, the reason why you're breathing right now is because you had a fight or flight and you decided to fight for your life and you put yourself in the safest place.
And I've always said that you are your biggest fighter.
You are. I've utilized a lot of things. I've utilized clinicians, I've utilized family and friends, resources, positive meditation videos. Like, I don't know if you heard that this morning with me. I try to utilize colors in what I wear, lots of different things like that. I know it sounds crazy, but
that's what you have to do to, keep your mental intact.
I wanted to ask you, like, with everything that was happening with your body, how is it that, you got to a place, like, I remember this place where you were like, I'm done, I'm shut down. I was talking with you while you were in the hospital at those times. Mm-hmm. What was happening? Like, how did you keep going? Like, how did you decide, you know what, I'm not going to let this.
I was talking to my dad about the other day, actually. I came to a point where people would come visit me in the hospital and they were like, oh, I'm so sorry you're going through this. And I got so tired of hearing it. And I said, Dad, the next time someone says that they want to come see you, tell them if they're coming to feel sorry for me, don't come. I say that because at that point, I was in my Bible. I said I needed a positivity, and the Bible was the only place I could find it. Right.
Yeah.
And I came to a passage in the Bible. I'm not going to quote it because I'm not good at quoting, but it basically said that God knew me before I was in my mother's womb. He knows the hairs on my head, everything. And with that, I took it like God knew I would be in this hospital bed dealing with this. And he knows how long or at what point it would start and when it would end. And at this point, I'm like, God ordained this to happen. So all I have to do is get to that point where I accept it. And so I just keep that in the back of my head that there's a reason I'm fighting. There's a reason I'm going through these. There's a reason why these health issues come up from time to time.
It really does come down to mindset, doesn't it? Mm-hmm. It's that choice. Okay. Can we talk about symptoms for a minute? Can we talk about
So I was looking at different symptoms, and
Okay.
you have like your general symptoms, like, you're irritable, you have outbursts, even if it's like a small little thing, you're just getting mad or irritated. But that actually happens more in children and teens. So, like your temper tantrums, you call them for the little kids or whatever the case is. Even with the little children, they get clingy. They get very clingy. Some refuse to go to school, or they're like underweight because they feel like, I got to look a certain way or whatever the case is. That can be a sign and symptoms for children and teens.
Can we just stop for a minute? Because I want you to continue.
Yeah.
But
Yeah.
one of the things that I want our audience to really realize is that kids go through this. Stop thinking that they don't. Yep. They're human beings.
Yep.
Yeah. Sorry. Go on, girl. My bad.
So our teens do all of that too. Their attendance in school or performance in school is very poor. They feel misunderstood. So that whole line, you don't understand me, like it could be a sign and symptom, or they're extremely sensitive. Any little thing, they're just so sensitive about it. The use of drugs and alcohol can be a sign and symptom. Also, if you're sleeping too much.
Oh yeah, that's true.
That can be one too, or if they're eating too much as well. Right?
Oh wow. Okay.
Or even if they lose interest in, like, they love soccer and basketball, but then all of a sudden they're like stepping back. They have no interest for it anymore. That could be a sign of symptom, and of course, like no social interaction.
Mm-hmm.
When you get into older adults now, it's not a normal part of older adults, and it often goes undiagnosed and untreated.
So we're talking about our elderly right now,
right? Elderly people, yeah. So symptoms can be different, or I want to say more or less obvious. So memory difficulties or personality changes, that can be a sign and symptom. Of course, we have other things that we might look at, but depression and mental health should also be looked at too.
Okay.
Physical aches and pains. That's what I said. It can be looked at as something else, but
it can manifest itself in a human physical form.
Exactly. Right. Fatigue and loss of appetite, and again, sleeping problems, not socializing. For adults, loss of interest of even having sex with your partner can be one.
It's not fun.
But that can, honestly, we'll probably get into that in another conversation.
Yeah, we are.
It can be a very big thing.
Yes.
And that doesn't have to be caused by a medical condition or medication. That's just what it is. They're not interested in it.
Yeah.
Not socializing. And then the suicidal thinking or feelings occur especially in the men.
This is a place where suicidal thoughts, men kind of excel in this area simply because men are more determined to make it a final action. Women will be maybe a more apprehensive and do a softer way of doing it. Men are just like, do it.
I think women are more open to speaking about it.
Yeah, that's true too. Okay, so let's talk about support, right? Because if you're having these feelings, if you feel depressed, you need to make an appointment to see your doctor as soon as you can, right? And if you don't want to talk to your doctor, please go and talk to a friend, a loved one, a healthcare professional, a faith leader, or just somebody that you trust, because you have to be able to release it from you in some way, shape, or form. And if it's an emergency, we're talking, if you're having the suicidal attempts, call 911 or your local emergency number. For those of you that don't know, if you truly are in a place where you're ready to take your life, you can voluntarily admit yourself into a hospital for them to take care of you and to help you and to put yourself in a safe environment so you won't hurt yourself, so that you can have a breath of life in another day or in another week. Okay? Let's talk about some treatments, because, first of all, everybody wants to go to the antidepressive pills, which have the other whole gamut of other except, but we want to give education about other things. So as we've been talking about, there's talk therapy, psychotherapy, which is normally used for the mild depressive places. There's CBT. I don't know if people have heard this. It's been around for a while. I've applied it for myself. Cognitive behavioral therapy, which focuses on problem solving in the present. So why are you thinking the way? It helps the person recognize any distorted or negative thinking with the goal of changing their thoughts and behaviors to respond in a more positive manner, right? And I'm not going to lie, it works. Sometimes we need to start putting our body and mind in motion, and we got to connect the two. So if you're doing Tai Chi, if you're doing meditation, if you're doing acupuncture, if you're getting massage therapy, music therapy, even just exercising, how does that help with your health? It gives you endorphins. Endorphins make you happy. But really and truthfully, it gets you moving. It gets your circulation. It corrects things in your body, especially if some of this is hormonal, right? And there's also, I want to talk about, because one of the things that's really big right now are the health apps that are out there. And they're great for general support and education. But please remember that this doesn't substitute for a doctor or a therapist who may be able to help you change your mindset, help you think differently, help you see differently, be a space to talk. And finally, I know I talked about the antidepressants. Let's talk about supplements, right? Because, on the medical side of things, everyone's just like depressants, antidepressants. But there are things like St. John worts or SAMe or omega-3 fatty acids that can help your body. Make sure, though, that if you are taking other medication prescriptions, that they don't, conflict with your pills. But have conversations with your doctor about, can we get me off of prescriptions and can we put me on supplements? So, you can have those conversations.
Yep. I love St. John's wort. I use it all the time.
Do you? My mom is always like, girl, take your St. John's wort.
It's not even just for that. It's for other things too, but we don't have time for that today.
No, we don't.
For lifestyle and home remedies, make sure to stick to your treatment plan. So if you stop, your symptoms might come back. So stick to the treatment plan.
Please.
There's a reason why they tell you, like, even if you're not done, follow out with your meds until it's done. There's a reason for that. Learn about depression. Don't be afraid to educate about your condition and how it can help you or your family. Pay attention to warning signs. It's a big one. Pay attention to them and learn your triggers. Avoid alcohol and recreational drugs, because that can
you.
Yeah, it won't lessen it. It'll make it even generally worse. And first and foremost, the number one thing I think should be first is to take care of yourself. Be healthy, be physically active, and get plenty of sleep. Not too much sleep, because you might be in that realm, but get enough sleep.
Find a good balance.
Yeah.
Find a good balance. And, when it comes to support and coping, some of the things that I've had to apply in my life and I would advise people is definitely simplify your life, cut back on obligations, because when you don't feel like you're fulfilling certain things, you become more depressed and guilty because you're not getting to your goals and you feel down.
Yeah.
Write in a journal. If you don't want to talk to a lot of people, like I said, getting it out, expressing it out, working it out, boxing it out, like getting it out can help. Read, when we're talking about, educating yourself, read your self-help books and look for reputable websites to learn about your stuff. You were asking me about my supports. Find helpful groups. They could be education groups, support groups. And like you said, one of the things is employment assistant programs and religious groups are always about your mental health concern. They normally have something there for you or your family. And I think that was really great that in you being your mama's child, her benefits covered over to you in terms of this aspect because of the severity of mental health.
Right.
Don't isolate yourself. I know this sounds like the biggest thing and you want to not be bothered by people and you want to be don't isolate yourself. It allows space for more darkness to come in. But when you have other people that shine light for you, it just brightens your space and it helps you come out. And you want to learn ways to relax and manage your stress, breathing techniques and other things like that. And one of the things that has helped is structuring your time so that your mind isn't all over the place. But if you know what you're doing, set rest times, set me time, set what you're doing, it might be able to keep you organized and in place. And here's the biggest one. Don't make decisions when you're down. I mean, you may not be able to apply all of them immediately, But in the list that we said, pick one or two to start with and try and be consistent with it, and then add on to it. And you'll see how you'll be able to start learning to manage your life and and things like that. One of my personal coping skills is the colors and the colors that I wear. If I'm really in a dark space, I try to put on bright colors. I know it sounds crazy, but it helps, So let's hope that some of this has helped you to stay out of your dark space. You know what I'm talking about? Yeah. Okay. Talking about dark space. Can we get to question of the week for a minute?
I'm eager to hear what people had to say.
Okay. So we were checking the streams and all of those different things. And it's really funny because we didn't get a lot of responses this week. And again, this is because we know that sometimes the staff people don't want to talk about it, but there have been a lot of people that have been giving thumbs up and giving hugs and being like, share your story, and I know where you've been. So no one wanted to give anything personal, which we completely understand, but we greatly appreciate the support because a lot of people are like, yeah, I've been in a dark space. And we're hoping and we're praying that you find the support to get out of it. We're hoping that you're praying that you can help someone else that might be in it and be able to be empathetic and show them how to get out of it. But that's where we were with our question of the week. So thank you for everybody that responded. But get us into our keep it moving moment.
Okay. So I love this keep it moving. It's so perfect.
Okay.
Your mental health is more important than your follower count on Instagram, someone else's perception of you, a meeting in your calendar, the number on the scale, your to-do list, your weekend plans, your appearance, the size of your house, your job title, and making everyone else happy. With all that, your mental health is more important.
It's so true. I
love it.
I love it.
I absolutely love that. So keep that in mind, guys. Your mental health is important over everything that we might worry about from day to day.
Mm-hmm.
Today, we're going to close the show by bringing awareness to the upcoming Canada-wide Bell Let's Talk Day on Thursday, January 28th, 2021.
So mental health can cause people to have problems doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. According to Mental Health Commission, the Commission, on any given week, more than 500,000 Canadians are unable to go to work due to mental health problems. Of that, more than 2 million people enrolled in Canadian post-secondary school institutions are schools. Almost 70% of our students who are 24 and under are susceptible to developing mental health issues.
In 2016, 40% of survey respondents said that they have never sought medical help for their depressed feeling. Now more than ever, every action counts. On Bell Let's Talk Day, Bell will donate more towards mental health initiatives in Canada by contributing 5 cents for every applicable text, call, tweet, or even a TikTok video using the hashtag Bell Let's Talk. Social media video views and use of our Facebook frame or Snapchat filter will contribute to that too.
Mm-hmm.
Well, guys, that's our show. I'm Sharifa McLaren Thomas from YouTube's The Thomas Live. Check me out.
And I'm Kalila Bruswell, the Overcomer.
Thanks for joining us for another episode of Chronic Pain Conversations. Next week, we will be back at 12 o'clock on Tuesday, same time, discussing Ehlers-Danlos syndrome. Be sure to follow us on Facebook, YouTube, Twitch, and Instagram at CP Conversations. And if you are a chronic pain sufferer who would like to share your story, we invite you to be our guest. Visit our bio link in any of our social media platforms. Have a blessed day, and remember, Chronic Pain Conversations is a show that enlightens and advocates about chronic pain.